Welcome. Today we're focusing on what's happening with veterans' disability benefits and some significant developments at the Department of Veterans Affairs.
That's right. We'll be covering the disability payments expected, I believe, around May 2025.
Yes, those specific figures we've been hearing about. And also the talk around potential VA workforce reductions. That's causing some discussion.
It certainly is. And finally, there's a new initiative aimed at improving how survivor benefits are handled.
So quite a bit to unpack. If you find this analysis helpful, please do take a moment to like and subscribe. It helps us continue bringing you these updates.
Okay, so starting with those May 2025 payments, we're talking about veterans with a service-connected disability, correct?
Exactly. It needs to be validated by the VA. You need that disability rating, and the right medical documents have to be in order.
And the figure we're seeing is $3,357.
That's the base amount being discussed for the main benefit. And there's potentially more, right, for dependents.
Yes, an additional $839 could be available depending on the veteran's family situation.
And these are monthly payments, tax-free, designed to help with, well, everyday living expenses, support families.
Right. The plan is for direct deposit, usually around the first of the month, so May 1st, 2025 is the target.
It sounds straightforward, but maintaining eligibility is key, isn't it?
Absolutely. Keeping your address up to date with the VA, income details, medical records, it's all crucial. Things change, and the VA needs current info.
And the disability rating itself, that can range quite a bit.
It does, from 10% up to 100%. That rating determines the specific benefit level.
And just to be clear, this is strictly for service-connected disabilities.
Correct. If a disability isn't related to military service, unfortunately, it wouldn't qualify for these particular benefits.
Okay. Now, moving on to the staffing situation at the VA, there's been talk of workforce reductions.
Yes. The VA Secretary, Doug Collins, mentioned a pre-decisional goal. That's the term used.
Pre-decisional, meaning it's not set in stone yet.
Apparently not. The goal mentioned was to reduce the workforce down to the size it was back in fiscal year 2019.
Wow. Do we know what that means in terms of numbers?
It translates to roughly 80,000 employees, which is about a 15% cut from current levels. It's significant.
But it is significant. And the secretary wasn't too happy this goal became public.
Reports suggest he expressed some frustration, emphasizing it's preliminary, could change, might be larger, might be smaller.
But the idea itself, reducing staff by that much, it's raised some eyebrows.
Definitely. You're seeing bipartisan concern from senators. They're questioning the lack of, detailed planning behind it.
What's their main point? Just the number seems arbitrary.
Kind of. They're asking for the data, the justification. The feeling seems to be that staffing should match veteran demand and, improve outcomes, not just hit a specific number from the past.
Has the secretary said who might be cut, or maybe more importantly, who wouldn't be?
He did state that frontline staff, doctors, nurses, benefits administrators wouldn't be targeted.
But lawmakers are skeptical. You can cut 80,000 people without hitting support roles that are also pretty critical.
That seems to be the concern, yes. How do you make such deep cuts without impacting the system somewhere? There's also been some criticism about how the VA gathered feedback internally using NDAs, apparently.
And we should remember the VA did increase staffing quite a bit recently, didn't they?
Yes, under the current administration, largely to handle the PASI-T Act influx. Many more veterans became eligible for care and benefits.
So the context is important, and the final plan for these reductions still pending.
Seems so. The timeline for when the final workforce plan will be ready has apparently been pushed back.
Okay, let's shift gears to survivor benefits. There's a new initiative here.
Yes, the VA announced a 3-part plan. The goal is to make it simpler and faster for survivors and dependents to access their benefits after a veteran or service member passes away.
Okay, what are the 3 parts?
First, they're moving the Office of Survivors Assistance, the OSA. It's going back to the Office of the VA Secretary.
Back. Where was it?
It had been moved into the Veterans Benefits Administration back in 2021, so this reverses that decision.
And the idea behind moving it back is?
To make it a central advisory body again, reporting directly to the top leadership, give it more influence on survivor-related policies and programs. It'll have a small team, about 5 people.
Okay, that's part 1. What's next?
Part 2 is launching what they're calling a white glove survivor outreach team. It'll be based in Philadelphia.
White glove. Sounds like personalized service.
That's the aim. Trained experts providing one-on-one guidance specifically for the dependency and indemnity compensation, or DIC, claims process, helping survivors through each step, trying to get eligible claims approved faster, and just improve communication.
That sounds Potentially very helpful. And the third part?
Automation. They plan to expand the use of automation in processing those DIC claims.
Is automation already being used?
Yes, they say it's already handling over 1,000 payments or adjustments daily. So this is about building on that, speeding things up even more, reducing delays, making it less burdensome for survivors.
Secretary Collins commented on this, didn't he? About cutting red tape.
He did. He emphasized wanting to eliminate bureaucratic hurdles for people who are already grieving.
And when is all this happening?
The rollout is starting pretty much immediately, or very soon, within this month, May 2025. Full implementation is expected throughout the rest of the year.
All right. Lastly, let's touch on potential future changes to disability benefits. These aren't happening now, but there are proposals being discussed.
Correct. It's important to stress nothing's enacted, but ideas are out there. For example, associated with what's known as Project 2025.
What kind of ideas are in that proposal?
Things like potential workforce cuts across federal agencies generally, which, could impact veterans working at the VA. Also, talk of potentially privatizing some VA services and maybe stricter eligibility rules for disability benefits down the line.
Any other proposals floating around?
The Congressional Budget Office, the CBO, has put out some options for deficit reduction in the past. These aren't active legislative proposals right now, but they included things like means testing benefits.
Meaning benefits could depend on income.
Potentially, yes. And also, age-based reductions for people starting benefits in 2026 or later. Again, these are just CBO options, not current VA policy or proposed law.
But these kinds of proposals, if they ever gain traction, could have significant impacts.
Absolutely. Concerns include reduced access to care, more financial strain on veterans, and just making the whole claims process even more complex.
And there's pushback against these ideas.
Oh, yes. Strong opposition from veterans organizations and many lawmakers across the board.
Has Secretary Collins addressed these future possibilities directly?
He has made public statements saying there are no current plans to cut veterans' benefits. His focus, he says, is on improving services.
Okay, so to wrap up, we've looked at the upcoming disability payments for May 2025, the significant concerns around those proposed VA workforce cuts,
and the new initiatives aimed at genuinely helping survivors access their benefits more easily. It's quite a dynamic situation at the VA right now.
It really is. You have this immediate financial support happening alongside these potential big shifts in how the VA operates and assists veterans in the future.
Staying informed about all these developments within the VA is just so important, especially considering the potential impact on those who've served.
Absolutely. It raises the question, doesn't it, about how best to balance efficiency and budget concerns with the fundamental need to support veterans and their families effectively. Something to keep thinking about.
Indeed.
Thank you for joining us for this analysis today. Please do like and subscribe if you'd like to stay updated with more explorations like this one.